The webinar will be 2 hours. It's in English. You are muted by default, but there will be the possibility during the Q&A session to actually raise your hand, and then you can also ask your questions actually if you want to speak. Otherwise, you can use the Q&A function to ask your questions. There is also the chat function that you can use if you want. Yeah, and I think that's pretty much it for the practicals information. So then I will present you the agenda for today. So we will start with a short introduction and a very short background about DEMAC. And then the key findings and the recommendations of the real-time review will be presented by Rachel Furlow, that I will present in a few minutes. The lead researcher for this research. There will be a Q&A, so the possibility to ask questions on the findings and the report. And then it will be followed by the panel discussion with representative of the Sudanese diaspora responders, as well as a representative of NTR News that can speak with both hats, being a diaspora self as well as humanitarian actors. And then there will be Q&A sessions. The Q&A will be actually after each of the panelists. There will be an opportunity to ask directly questions for the presenter. Yes. So quickly, what is DEMAC? So DEMAC stands for Diaspora Emergency Action and Coordination. This initiative for Sudan is funded by the H2H network in collaboration with the partners of CDAC and NTR News, that we were part together in a consortium, so the ARISE consortium, to try to find more evidence and around for DEMAC diaspora engagement during the conflict and the response, and CDAC and NTR News as well, doing also social media listening and trying to improve communication with communities within the response. Yes, so it was to provide reliable coordinated communication services, and for DEMAC to conduct this real-time review that we will present to you shortly. And DEMAC aims to facilitate a global network of diaspora organizations through 3 objectives. The first one being increasing awareness for diaspora humanitarian interventions. Next slide. Enhancing knowledge between diaspora and humanitarian institutions. So that's why we are doing those type of research, and we are sharing and trying to disseminate the findings that we have when we are conducting such research, and improving coordination and communication and coherence of humanitarian response across diaspora and institutional humanitarian actors. So that's the main missions and vision, objectives of DEMAC, is actually to give a bigger awareness of the role of diaspora as humanitarian actors, as well as improving the coordination and information sharing for those actors to try to find synergies and work better towards humanitarian response. And here we've been focusing on Sudan, and I will then give the floor to Rachel Furlow, that was conducting this research. Rachel is a research manager for Sudan at Consilient, and serves as focal point for Sudan-related business and project implementation matters. She was previously based in Khartoum and now operating from a Consilient Sudan satellite office in Nairobi. She led numerous research initiatives at Conciliant, including political analysis in the Blue Nile and South Kordofan states, food security assessment in East Darfur, and health system monitoring in Khartoum. Prior to Conciliant, she has also worked with organizations such as the World Bank, search for common ground at the Danish Refugee Council. So the floor is yours, Rachel, for presenting the key findings and the recommendation of this research. Over to you.
Thanks very much, Beatrice, for the introduction, and thanks to you all for joining out of what I know is a very busy time for a lot of people, so much appreciated. But I can just kind of kick it off with, to be honest, a pretty short summary of the findings and recommendations, because unfortunately we don't have time to dig into it all. But I hope that, you know, our panelists who have been working on these issues, the first slide. Do you mind? Oh, thanks. So first, I just want to give you a little bit of background on what the real-time review was and how we conducted it, just to kind of put the context in your mind. So essentially, it was a primarily qualitative research approach that took a couple steps. So the first step was a desk review. So that was kind of identification of diaspora actors in Sudan. Second was a social media monitoring. So of the diaspora actors that we identified, which was a total of 60, we did a social media monitoring for what they've been doing since April 15th, essentially. And then the last step was actually doing a series of key informant interviews with different diaspora actors. A couple of things I want to note with this methodology is that one, as you can see, it was primarily done online through social media. So there may be, I mean, not maybe, I'm sure there are many, many diaspora organizations and associations that may not have a strong online presence, so therefore may not be fully incorporated into the review. And second, as we all know, those of us who've been kind of involved in this response or working with diasporas, a lot of organizing was taking place informally, particularly over WhatsApp groups or other private communication channels. And some of those efforts we were able to capture, and there were many, of course, that we were not. So we are kind of aware of some of the limitations of this methodology. But we've talked to, you know, a number of diaspora actors and feel like it's still helpful. So move on to the next slide. So first, kind of what we found in terms of the diaspora composition and their response types, both sectorally and geographically. So we identified 60 diaspora actors. Again, this is really probably only a fraction of the diaspora groups that were included. And this is partially because, as we noted, almost half of the diaspora actors that we identified are actually informal actors. So they're not formal registered organizations. Instead, they're new informal diaspora networks. So even Sudanese diaspora, we can call them Sudanese who were displaced from Sudan after April 15th, as well as so networks of individuals that are informal who have just started to create organizations or networks, as well as diaspora individuals that have been very influential. In terms of, you know, where they are geographically, a majority of them, we found almost 60% resided in the United States, United Kingdom, also with hubs in the Gulf states and Australia. One of the reasons we think this was kind of overrepresented in the United States, the United Kingdom, is just because most of the more visible or politically active diaspora groups are residing in countries where they have more freedom to organize. So we do know that there is a very strong Sudanese diaspora in the Gulf, for example. However, because of regulatory and political challenges, they're less likely to be registered and less likely to be active online where we found them. In terms of their geographic reach inside Sudan, in terms of where they were responding to and where they were operating in the past 6 months, we found that there were a couple of different hubs. The first is obviously Khartoum. This was mostly in terms of the information sharing, as well as fundraising and sending funds abroad, as well as the hubs of displacement since the start of the conflict. So Wad Mendi, Wadi Halfa, Kassala, areas where there have been kind of significant clustering of displaced populations inside Sudan, where there is a good amount of access for diaspora organizations. And then finally, neighboring countries. So there have actually been a lot of diaspora responding with displaced Sudanese abroad, particularly in Egypt and in South Sudan. There were some organizations, diaspora actors that tried to operate in, for example, the Darfur region. However, it was significantly difficult for many diaspora organizations to work in these areas due to kind of the operational and security risks, as well as most diaspora relied on their personal networks in terms of where they operated. So many diaspora were from Khartoum or the last place of residence in Sudan before they were abroad was Khartoum. And so that's where a majority of their network is. And so when they're trying to operate, send funds abroad, send supplies, as I'll talk about later, they're really relying on their networks. And so therefore, that's why some of these geographic clusters are occurring. In terms of areas of intervention, we found that it's actually, there are a couple sectoral areas of intervention, but what's most interesting about the diaspora response is it's really evolved as the conflict has evolved. So in terms of sectorally, there's been a very strong emphasis on health, which I think one of our diaspora kind of panelists will speak about later. And this was because, one, there are a lot of Sudanese diaspora organizations that have health or medical professional backgrounds, so they're relying on their areas of expertise. And obviously, as many of you know, health and medical supplies has been a key issue since the start of the conflict. And so it's kind of identified as a key area of need. In terms of how it evolved, in the initial kind of area of intervention for many diaspora was just information sharing. And this was in the initial weeks or months of the war, which started in Khartoum, and a lot of the information that was initially shared was about being able to access basic supplies, transportation, evacuation routes out of Khartoum, and that the diaspora really mobilized to share on social media and through private messaging groups how people inside Sudan, inside Khartoum could do that. In the next month or so, it really shifted more towards advocacy. So advocacy in terms of, ceasefire to the conflict, as well as advocacy to support visa-free travel for Sudanese people, or just humanitarian corridors. It also quickly transformed into fundraising. Once diaspora, either informal networks, communities, or even informal organizations started to kind of collect their efforts, there was a significant amount of funds collected and then transferred into Sudan. And then finally, as we're seeing in the most recent couple months, there have been a number of diaspora organizations that have recognized that, this conflict has really, unfortunately, become protracted, and that there needs to be an emphasis on long-term support for those displaced inside Sudan as well as outside Sudan. So focus on education and employment. Move on to the next slide. So this is a little bit of what I talked about. It's going to be the evolution of how we saw this kind of the response share. So starting in information sharing, move on to the provisional of material aid and funds, and now finally kind of an increased focus on longer term development as a supplement to the humanitarian support being provided. So the first topic I really want to talk about is fundraising, because I'm sure many of you are aware, you've even participated in, there have been a massive number of fundraising initiatives undertaken by the Sudanese diaspora. Just only what we could identify online that was explicitly stated is there's $566,000 that have been raised by diaspora organizations or individuals, and this is almost positively an underestimation of the amount of money that has been raised, because much of the money we found was raised by informal community networks. So it's not necessarily, in the public records or something that we could find. So this is definitely an underestimation of the funds that were raised. Generally, funds were raised, as I said, by either smaller informal diaspora networks or even individuals who can support the movement of kind of small scale funds, so less than $5,000 usually, through mobile money applications, through informal transfer networks, or much of the funds was then raised by larger established diaspora organizations who are registered in their country of residence, because that's often a legal requirement to raise funds, and who have the capacity to obtain and spend large amounts of funds. However, these organizations that are registered, it's important to note that many of them were largely based in North America or Europe, because many diaspora actors in the Gulf states that face pretty restrictive funding regulations, which hinders their ability to send or receive funds to Sudan. So there is some limitations faced by the diaspora. What's interesting to note is there was actually a fundraising gap among what you could call medium-sized or informal diaspora organizations. So these are diaspora organizations that are either not registered in their country of residence or are newly formed. So there are many initiatives that have popped up since the start of the war. And these organizations reported not being able to, one, legally receive funds because of registration issues, to not understand how to raise funds beyond crowdsourcing, because, so for example, how to access grants or how to access larger funding pools due to the complexity of kind of some of those requirements, or three, even reporting that they do not have the internal capacity to absorb significant funds. So a lot of organizations that reported that they just didn't feel it was responsible to collect certain amount of funds because they didn't have the internal kind of accounting or finance teams to do so. The next topic I want to touch on is coordination. So there's three types of coordination that we looked at: coordination among diaspora actors, coordination between diaspora actors and local organizations or local actors, and then coordination between diaspora actors and international humanitarian organizations. One thing that we found that, I'm pretty sure most of you who work on this could guess is that there are very strong personal networks among many diaspora actors who often know each other from Sudan. They know each other personally, professionally, and that's facilitated a significant amount of inter-diaspora information sharing and coordination throughout the war. So for example, there are diaspora actors who have partnered together on initiatives on education and employment for those who've been displaced from Sudan. However, at the same time, relying on strong personal networks among diaspora actors means that sometimes there are many diaspora actors operating in relative silos in which they're not aware of what other organizations are doing or operating in their space, which can lead to potential duplication of efforts, or their network for coordination is limited to their personal networks. So there are other diaspora actors they might not know personally, who they haven't been able to kind of coordinate with. So there is, of course, strong coordination, but also a lot of room to grow and to improve coordination among diaspora actors. The second is coordination between diaspora organizations and local organizations. So there have been many, many examples of diaspora organization partnering with local NGOs or just local actors who are maybe unofficial or unregistered to distribute aid or mitigate challenges. So for example, diaspora actors or organizations who are not registered in Sudan with the administration rely on local NGOs to do so, or even local NGOs in third countries where there are displaced Sudanese. And then third is coordination among diaspora actors and international humanitarian actors, which there have been, significant gaps. It's been lacking in the past 6 months, with most respondents that we spoke to reporting they really don't know what the other is working on, nor do they know how to contact each other. Some diaspora respondents stated that they've reached out to international humanitarian organizations and received no response or received negative responses. While some international humanitarian organizations reported that diaspora, although it's helpful in the initial stages of the war to kind of understand some of the conditions on the ground, they would be best positioned to connect them with local actors who are better suited as partners for international humanitarian organizations, who often just want to send funds directly to local organizations instead of through a third party, which is kind of what they've referred to diaspora organizations as. However, both parties did acknowledge that there are benefits to increasing coordination among them. It's mostly just a lack of awareness and kind of understanding on how to communicate with each other. The next topic I'll talk about is very long acronym, CCEA, but essentially kind of focusing on understanding how diaspora communicate with communities, how they're accountable to the communities that they're providing aid or funds to, or how they engage them and understanding what the needs are. So what we did find is that diaspora actors have been very active since the start of the conflict, sharing information and resources, and they're actually very well positioned to communicate with affected communities inside Sudan because of their obviously personal and professional networks inside Sudan. This includes kind of both public information sharing and resources, as well as just private messaging channels and private channels to communicate information and understand the conditions on the ground. However, many diaspora actors did also state that they conduct relatively robust needs assessment type activities, and such as PDM, post-distribution monitoring, which actually was an interesting finding considering that the overarching assumption is that diaspora actors, especially those that are new, those that are informal, have less capacity, so to speak, to engage in monitoring and evaluation compared to larger international humanitarian organizations. We actually found that that's really not true. I think almost half of the diaspora respondents that we spoke to had engaged in some sort of fairly robust M&E activities, including actual representative surveys of populations that they were working with. So there is actually an ability and a drive for many diaspora organizations to do this despite concerns of accountability among kind of international humanitarian organizations. In terms of other parts of communication that was really critical, and that's communication among actors who were working to respond. So communication between diaspora actors and international humanitarian organizations. So most most diaspora organizations interviewed reported that they were actually not aware of information sharing mechanisms with the international humanitarian community and would not know how to access them. There were a couple of respondents who said that they did have contacts inside the humanitarian cluster system in particular, but that was because of their professional networks. So it was very biased in terms of what types of diaspora organizations could access those mechanisms. And then the international humanitarian organizations, on the other hand, stated that they hadn't received requests from diaspora organizations to join some of these mechanisms. So there is definitely a gap in communication between diaspora actors and international humanitarian organizations that can be bridged really from both sides. Now I just kind of want to speak broadly about what are the strengths of the diaspora response, and then I'll speak a little bit about the challenges as well. So one of the real strengths of the diaspora response that we've seen is, of course, their ability to communicate effectively with local communities. So this includes the networks and communication channels they already have with local communities who are affected by the war, as well as their ability to use kind of informal communication channels. For example, I'm sure many of you who are on social media have seen that those inside Sudan in the initial weeks or months now of the conflict have been using specific hashtags, like hashtag immediate need, to kind of address what are the immediate needs in the community, and that's been picked up by diaspora and amplified. So this kind of flexibility in how you are communicating with communities when you really don't have the capacity to do formal surveys or formal needs assessments, so to speak. And this is also true in terms of diaspora reach in difficult to reach locations. So there are many diaspora organizations who have been communicating pretty consistently with affected communities in areas such as most of the Darfur region, which humanitarian actors really have not been able to access up until recently. And so there is a really important strength of the diaspora that they are able to communicate with local communities on short notice and through kind of flexible mechanisms. The second is innovative methods to navigate operational barriers. Since the start of the war, many international humanitarian organizations, I'd say most, if not all, have faced operational barriers in terms of security, in terms of just logistics. For example, how to transfer money into Sudan when the clearance system is not functioning. However, diaspora, because many of them who have been outside of Sudan for a long time and have known how to transfer funds, as well as just their communication and understanding of different financial mechanisms, for example, to transfer funds, have been able to really more effectively transfer in funds raised into Sudan, given that it's in relatively small amounts, which is a barrier. And this is kind of the innovative methods, because of their knowledge of the area, because of their connections inside Sudan, is something that Diaspora can really contribute to the response efforts that humanitarian organizations may not necessarily be able to do. And then last, mobilizing volunteers on the ground. Diaspora efforts, when they are physical aid efforts, have actually been able to mobilize so many volunteers on the ground that they stopped accepting applications. So they do really have, again, these strong networks on the ground that can contribute to a larger humanitarian response. And then I'll talk a little bit about the challenges that Diaspora are facing. I think the first one, and our Diaspora panels may be able to speak to this, is the inability to receive and process funding. This is for a number of reasons that I've discussed. First is Diaspora organizations who are simply not registered, who can't legally receive funding. And then second is perhaps organizations or networks that are informal or new may not have the finance or accounting staff to process the funding that they do receive. So what this leads to is many diaspora organizations who have been operating kind of with limited funding and mostly on personal funding that they've used, or are really kind of more on an advisory level than being able to deliver aid. Or it really has led to a situation when many diaspora organizations, the individuals that are working for them are working as volunteers while they're maintaining another job, or while they're maintaining or seeking employment elsewhere. And this kind of leads to the second point or challenge that diaspora have faced, and this is this challenge of overwork and internal capacity in the past 6 months. And I don't mean capacity in really the traditional sense, but really just the fact that many diaspora who are working or volunteering for these organizations, one, are, as some said, are likely to be supporting at least 1 to 2 households inside Sudan, materially, financially, and also maintain their own employment in third countries, and also are really dealing with kind of the emotional and mental toll that this conflict has taken on them and their families. And so there's been a lot of significant burnout among diaspora who've been trying to contribute to the response, which is not, it is only hindered by the fact that they aren't able to receive funding to create organizations that are able to operate kind of on a more sustainable level. And then the third one is political divisions and perceptions. There are some reports of diaspora organizations operating inside Sudan who, for operational administrative concerns, do have relationships with local government officials in different areas, or essentially just are born out of some of the political issues that have been occurring in Sudan in the past couple of years. So there are many that came out of the 2018 revolution, a very strong political stances, and that has really materially impacted where they're able to distribute aid at some points. Now, I do want to be careful with how we frame this challenge, because really no actor operating inside Sudan is immune from this challenge at the moment. International humanitarian organizations also have to often play by their own kind of political challenges or issues in terms of accessing areas of aid. But with this, I just wanted to highlight that diaspora are also not immune from this challenge. And it can be an issue in terms of perceptions of neutrality that humanitarian organizations might want to uphold, or just the ability to distribute aid in different parts of Sudan. So finally, I'll just move quickly on to the recommendations. So I'll start with recommendations for diaspora actors. So the first one is developing cohesive organizational statements and objectives. So although diaspora actors have been really responding across sectors based on what they perceive are emerging needs, they'll often, because of this, lack clear organizational objectives, because perhaps there may be new organizations, or they're just responding again where they see need. It makes it difficult for them to work with international humanitarian organizations because they don't fit neatly into pillars or units of funding or support. So many international humanitarian actors, when asked, how could these organizations, diaspora organizations, seek funding opportunities, say, well, it's difficult for us to slot them into one of our units because they work on so many issues, and they don't have, for example, a clear theory of change, so to speak. So diaspora organizations that kind of seek this funding or support should consider developing robust organizational strategies and longer term plans defined by, what the international community would see as a theory of change, so to speak. The second is to establish coordination mechanisms within the diaspora space. So as I spoke to earlier, diaspora have been organizing among themselves. However, there are actually many diaspora initiatives that are still happening in silos. So to increase awareness, both externally and even within the diaspora community itself, they should collaborate to develop coordination mechanisms on, for example, sectoral or important lines. And there are already diaspora initiatives that are starting to do this. But increasing that would help to support in establishing key points of contact for international actors, as well as kind of breaking down some of those silos between diaspora organizations. The third is considering non-humanitarian funding opportunities. Many diaspora organizations, a key concern is where they can get funding and support. However, because of bureaucratic and other restrictions, perhaps has limited the ability of diaspora actors to seek funds from the international humanitarian system. And instead, there are actually kind of more alternative routes that diaspora actors can consider to engage and seek funding. So for example, civil society units may be more open to non-local organizations or organizations that don't fit the traditional humanitarian sector, or even seeking individual consultancy funding for specific short-term initiatives. So if your organization is not registered, but you have a very specific idea that you want to implement, seeking that through an individual consultancy rather than as a grant for an organization may be easier. 4 is compiling needs assessments when conducted to share with external actors. So one thing that international humanitarian organizations stated is that, they knew that the diaspora actors were potentially conducting these needs assessments or collecting information on the ground, but they didn't know where to access it, how to gather all of this information together to make it useful for them. So to better present this information, diaspora actors could really take advantage of the access they have to compile some of these needs assessments together through, for example, a coordination mechanism within the diaspora space. 5th is expanding hubs of information and resource sharing on collaborative platforms. So there are quite a few diaspora organizations that one of their initiatives has been creating a platform or a hub on their website that shares resources, that shares information, which is very helpful for a number of affected communities to support evacuation routes, to know who to contact to get basic supplies. However, it's also kind of proliferated among the diaspora space. So consolidating that into a single or a set of platforms for ease of access could support kind of more consolidated information, as well as potentially mitigate the possibility of misinformation. And now I'll go on to finally recommendations for international humanitarian actors. For international humanitarian actors, one of the first recommendations is consider hosting co-design workshops, so to speak, with diaspora to collaborate on aid initiatives. So one of the barriers or issues cited by international humanitarian actors was, one, diaspora organizations don't have these clear theories of change or don't have clear organizational objectives, and 2, they don't know who these diaspora actors are. But if they were hosting, for example, something like a co-design workshop or support workshop, this could support newly formed diaspora organizations develop organizational strategies and theories of change in kind of the parameters sought by the international kind of development community. And it could also just help in terms of networking, in terms of knowing who is working in what space and the sharing of ideas and information to support the response. The second recommendation is to allocate funding for specific diaspora initiatives. So for example, if international humanitarian actors find it challenging to just offer specific grants or kind of broader grants and feel like that money should go directly to local organizations, they could consider allocating funds to address specific challenges that diaspora might be particularly suited to address. So for example, creating an innovation challenge among different actors to create reliable mobile banking solutions, or I know that one of our panelists here today is working on job placement opportunities. So providing a specific grant for a specific diaspora initiative might be easier in terms of funding allocation than general grants. And then finally, the third point is to encourage more active diaspora engagement units. One challenge reported by diaspora organizations who've reached out to international humanitarian actors is either one, they don't know who to reach out to, or two, the people they did reach out to were unfamiliar with working with diaspora, or that was just simply not part of their job description. And so they did not receive positive responses. However, developing stronger diaspora engagement points of contact really at the operational level of international humanitarian organizations would be particularly helpful to more concretely coordinate on the ground aid efforts. Also support in streamlining communication with diaspora actors and support in identifying areas of potential engagement. So that is a very brief overview of kind of what we found initially in the real-time review. And I'm sure our panelists will speak to a lot of these themes, but I'm also happy now to take questions and discuss further.
Thank you, Rachel. Yes, so it's time now. If you have questions, you can either use a Q&A to ask the questions in writing, but you can also raise your hand if you want to ask your questions orally. So please, if you have any, it's time for questions. Otherwise, we can also, take the questions later if they are coming later, but yes, we have Dr. Henry. If you want to speak and ask your questions, you can unmute yourself.
Yeah, it's not a question as such, it's just a request. Thank you for this nice presentation. If there is a way to get a recording for other colleagues who are supposed to join, but because of challenges related to internet connectivity, they could not do so, really appreciate. Thank you.
Yes, definitely. So this session is recorded and will be shared and will be available on our DEMAC YouTube channel, as well as a report and the executive summary will be also available and will be shared in the chat later. So yes, definitely you'll be able to share. So any questions for Rachel for the findings that were presented? Any reflections or impressions from the audience today? Actually, I had a question for you, Rachel. If you found that there have been a difference with the younger generation in developing the different forms of diaspora initiatives, yes, if they had different ways of operating compared to more established organizations. Did you see anything during your research around that?
Yeah, I think that's a great question. I mean, I don't know if, to be honest, just larger diaspora organizations, one who are registered and more established for long periods of time, just simply operated differently than what we saw kind of informal new networks, which were often formed by younger people. And this was kind of in two ways, and I think by design as well. A lot of the newer initiatives, especially those that were formed by young people, were more active online. So they were extremely active in terms of information and resource sharing, which although some established organizations were as well, it was definitely the case for for younger organizations who are better able to use online platforms, better able to use potentially social media in terms of sharing or disseminating information or highlighting needs that were being shared online. In terms of, other larger established organizations, I think one thing that they were more effective at has just simply been the delivery of material aid and resources. That is largely because, they are registered, right? So they can raise significant funds. They perhaps have the networks or the infrastructure already built up to deliver material aid. So I think there's definitely a difference in how those two groups operated. But I think they actually complemented each other quite well at points in terms of their strengths.
Thank you, Rachel. It's indeed very interesting. We have we have a questions here on the chat. You mentioned that you came across some entities that are trying to coordinate diaspora groups. Can you give specific examples?
Sure, yeah, happy to. I think one larger kind of network or organization, so to speak, that's been working with diaspora in Sudan for a long time and has been trying to work with and coordinate diaspora is Shabaka, who we're happy, I'm sure Beatrice can share the link in the group. And another one that's kind of been formed since the start of the conflict is Insenia's Sudan Crisis Hub, which many of you are probably familiar with, who've actually been very active. And when the kind of full report comes out, you'll see some examples of this. They've been very active in developing task forces, so to speak. So they've been organizing their diaspora organization members in terms of, for example, the sectors they're working in. So they're looking to they have a health sector. So diaspora organizations who are working on health are kind of coordinating among themselves. They've done one on youth, for example. They're looking at one on employment and education. So that's still kind of in its initial stages, but another example of a diaspora-led coordination effort.
Yes, thank you. Then we have another question. Can you speak to burnout and what, if any, of the consequence of burnout among registered groups where they propose humanitarian or other sectors?
Sure, I can speak a little bit to this, but to be honest, I think our diaspora panelists will be able to give a much better answer to this and, if they'd like to speak on how it's affected them. But essentially, when I was speaking to a lot of diaspora, especially those who were in Khartoum when the war started, they initially dealt with kind of either the primary trauma of experiencing conflict and even secondary trauma if they were already abroad, of their friends, their family trying to evacuate Khartoum or experiencing conflict or violence in areas such as Darfur. So they were wearing really multiple hats at one time for a long time. So it's one, on a personal level, worrying about themselves, worrying about their friends, worrying about their family, about their country. Second, trying to support in any way they can in terms of diaspora response efforts. So whether that's forming an entirely new organization or spending many, many hours sharing information online or resources, just doing whatever they can to support the response. And this is all in kind of on top of, if they're already abroad or if they're moving abroad, their actual kind of own livelihoods and their own logistical concerns. So if they have a full-time job in their country of residence, or if they were displaced from their employment in Sudan and are trying to find employment elsewhere. So they're really wearing many, many hats. And I think it's both an emotional and mental toll, as well as a toll on how much they're able to do as a diaspora in their organization, because that they were juggling so many tasks at one time. But again, I think our diaspora panelists later might like to speak on this more.
Yes, thank you, Rachel. Then we have a hand from the audience, from #PO. If you want to ask your question, you can unmute yourself. You're still muted. Now you're unmuted.
Yes, you hear me?
Yes.
Yes, my question is that in the geographical reach, you talk about some areas that hosting diaspora, but we didn't talk about those who are in Uganda and in Chad. Whether you have any information for those are currently in Chad and Uganda. Thank you very much. Over.
Yeah, I'm really glad you brought that up because I think, I mean, of course, there are now massive populations of Sudanese who were either previously or have now been displaced to Chad, or many Sudanese who are now in places such as Uganda or in Kenya, even, for example. There are massive Sudanese diaspora communities who are here now. I think one of the reasons that it wasn't really captured as the majority community in this study is twofold. I think the first reason is that more diaspora organizations who are more formal, who are registered, are actually, there is a majority of them in the United States and United Kingdom. And when we spoke to diaspora actors and we asked them, where are the Sudanese diaspora hubs? The first response was almost always the UK or the United States, sometimes Australia or the Gulf. And I think the second reason is many of the diaspora networks in places like Chad or Uganda, many of those have been formed since the start of the war. And I think they're often more informal and less active online, or less active formally. So it's often these organization efforts that are happening through private channels of communication, WhatsApp, or just offline, just by calling and talking to people that they know inside Sudan. So that just methodologically, that was more difficult to capture. But we do know that in addition to formal or kind of established diaspora networks, organizations, there are countless other informal communication between Sudanese diaspora and affected communities inside Sudan.
Thank you, Rachel. I can see we have some more questions, but we have to move on if we want to keep the time. So we might be able to actually ask those questions with the panelists. So don't worry, it will be addressed later. But I would like to introduce you now to the panelists that will be speaking. So we have with us today Hiba Sada, that is representing Job for Sudan. We have Yassir Youssef El Amin, that is representing as the president the Sudanese American Physician Association, SAPA. And we have Osama Mahmoud, that is representing Darfur Union in the UK. And finally, we have Asia Kambal, that is representing Internews with us today. So the Hiba, Yassir, and Osama are representing Diaspora organization. Asia is representing Internews, but also with a double hat, being as well Diaspora herself, and have been very engaged with DEMAC and the Diaspora supporting us a lot. So we are very pleased to have you as well in the panel today. In order to move on, then I will present you Hiba Sada, who is a development practitioner with focus on humanitarian work, sustainable development, and grassroots initiatives. She's passionate about empowering youth and advocating for community causes. A graduate of the School of Management Studies at Hafid University for Women, Sudan. Currently working at Mercy Corps in Sudan on peace building and women's empowerment. She's the founder of SADA Educational Initiative, paying tuition fees and providing necessary resources to students. Global Peace Ambassador for Sudan through the Global Peace Chain Organization, and volunteer at Partnership and Community Relations Manager with Job for Sudan. Thank you, Hiba, for being with us today. And please, I will let you present Job for Sudan, what you have been doing, as well as reflecting on the challenges linked to what has been presented by Rachel earlier today.
Thank you so much, Beatrice.
You can turn your camera as well if you want.
I'm so pleased to be here among all of you guys. I'll give you an overview about what we're doing in Jobs for Sudan, like a quick introduction of the overall things that we've been doing. So Jobs for Sudan was created in May 2023. As a response to the war in Sudan, the outbreak of the conflicts since the 15th of April, as we all know, with the objective of supporting the Sudanese professionals and talents who had to flee the country and start like new journeys abroad. We know very well that it's extremely challenging for someone to start like a new career and find like employment ways and methods in the international market because it's extremely competent. So Jobs for Sudan recognizes that finding employment is crucial for the safety, the mental health, and the societal integration of refugees and displaced individuals. We also know very well how it's important for the refugee families to have like at least one of the family members like securing their employments during these hard times. We're very glad to grow to become a global initiative with the aim of helping displaced Sudanese job seekers find and secure employment and advancing their skills. We have like volunteers from different places around the world now. May you please go to the next slide? So our mission is basically to empower the displaced Sudanese refugees on their journey. We provide support throughout every step of their employment journey, from the job search, the upskilling, and the career mentoring through the comprehensive job search assistance. Can you go to the next slide, please? Our vision mainly revolves around the future of Sudanese and their empowerment. We're dedicated to being a beacon of hope, a catalyst for change, and a force for the betterment of our shared humanity. So we at Jobs for Sudan, with our partners, our supporters, and the beneficiaries, we aim to shape a world where displacement is a temporary challenge on the path to brighter, self-determined futures. Next, please. So how are we aiming to help? We have like 4 main sectors, which is the employment support, the career mentorship programs, the skill development programs, and working with refugee camps and programs. In terms of employment support, we're partnering with employers and recruiters, and we're sharing vacancies on social media platforms. We have social media accounts on Instagram, Facebook, Twitter, and Facebook. The career mentorship program is basically career coaching and counseling. And then we match the experienced mentors with the job seekers. We have also in the skill development sector, we do weekly online webinars, and we're starting the offline workshops and skills development programs in the UAE, Egypt, and in Sudan as well. We're currently collaborating with Al-Kaybulan for Sudan Aid in South Sudan. This is currently on pause, but we're planning to have a lot of activities with them in the upcoming month. So here we can see like we have 18 states. According to the IOM reports, only 2 of them, which is the Northern and Sinnar states, are having like lower IDP numbers, which is extremely severe, because you can see like Al Jazeera has the largest number of refugees or internally displaced people. So in general, we have like 500 plus Sudanese job seekers in our database. The largest number of them are based in Egypt currently. Others are in Sudan. Then comes the UAE and KSA. We have 20 plus years experience with some of our talents and the job seekers that we have in our database. So we have like a variety of fresh graduates and experienced individuals. Next, please. So our achievements since we started on May 2023 till October, we did mainly 3 objectives, which is the training and development. We did 20 webinars. We had 100 attendees. August was mainly dedicated to as a health month. September, scholarship webinars. So September was basically containing webinars like speaking and sharing awareness on the ongoing scholarships and like ways to access them and secure like scholarships for your future studies. 8K followers on LinkedIn and 1.5K on Facebook, 2.7 followers on Instagram. So our numbers are rapidly growing. Like people are starting to recognize us more and more by the day. The mentorship programs, we have 130 job seekers registered in the program in the past 3 months. And we have 120 mentors. In terms of the employment support, we have over 500 registered job seekers in our database, as I said in the previous slide. We're collaborating with different employers and organizations, including the Danish Refugee Council in Sudan and the IREX. Next, please. So here comes the most important slide to me personally, where we have the challenges. We're facing 3 major challenges at Jobs for Sudan since we started. First, there's the human resources challenge, because the roles require a commitment, like part-time or full-time paid employees, as volunteers have limited capacities because they might be having like other commitments in terms of having like full-time jobs or other stuff to do. So this is like a bit challenging for us to keep all the work ongoing with the same rhythm throughout every week. So then we have the financial resources. I think the UN and the INGOs in general and the government fundings are not reaching its intended beneficiaries and not helping Sudanese initiatives, including Jobs for Sudan. So we're having like, we're currently working with the time and financial resources of the volunteers, as I mentioned. The volunteers are not paid. They are like just volunteering their times and efforts with Jobs for Sudan and the founders as well, without any financial support. Finally, which is like the most important highlight of this, is the legal status of Jobs for Sudan. We're trying to get registered as a CSO, a civil society organization, or a national NGO in the UAE or Egypt or Sudan, but it's extremely challenging. We thought of being registered in the US, but this will limit the access to the fundings and grants that we get. So we're not able to register Jobs for Sudan, making it difficult to receive any grants or fundings from donors. We're so pleased to announce that we have 4 upcoming planned projects, starting with the on-site training programs in Egypt in collaboration with training centers and institutes like Al Ula Training Center, which is a well-known training center that was operating back in Sudan. We're signing memorandums of association with agencies in the UAE, KSA, and Qatar, because this is where most of the Sudanese individuals are seeking employment, and they're like currently buying work visas and work permits to go there. So then remains the challenge of securing the job itself. So we're trying to sort this out with the recruiting agencies. Third, we have on-site training programs and capacity building workshops in Sudan in collaboration with the Sudanese Youth Council. This will take place in the states where like the conflicts are not very extreme. For example, like Al-Ghadarif state and the northern state. Fourth, we have the vocation training and art therapy programs for Sudanese refugees in South Sudan in collaboration with Al-Kaibulan for Sudan Aid, as I mentioned. And this will be basically like art therapy programs for the refugees that had to go from places like South Darfur, Niala, and so they had to they went through a lot to be able to get to safe places. So we're trying to support them through these means. Next. In conclusion, this is like our organization chart. Starting with Ala Al-Haj, who started this originally since May 2023. We have 5 different departments, which is the business development and strategy, the career development, partnerships and communities, the digital media, and the programs department. That's all from my side. Thank you for listening. I'll be very happy to listen to your questions, reflections, or any comments and recommendations. Thank you all.
Thank you, Hiba. Thank you very much and very impressive what you've been doing since May 2023 and highlighting the challenges that actually are similar to the challenges that were highlighted already by Rachel during the research. If you can turn on maybe your camera just during the questions so that people can see you. And I don't know if you've seen the comment from Asia, or if Asia wants to say that comment herself, but she's mentioning that it's such a relevant and important initiative, and this was one of the key needs that was found by Internews during their social media listening, that there was a need of job opportunities and due to the loss of livelihood and displacement. So this is a very important initiative you are doing together with your colleagues.
Yes, extremely. I read Asia's comment on the chat, and I think, yes, we can find like various collaboration means between Jobs for Sudan and Internews. I'll reach out to you, Asia, after this meeting.
There was a question before, and I'm thinking that maybe it could be one that could be addressed to you about how difficult or how easy was it for you as a diaspora organization to find local civil society organization to partner to do your initiatives. Was it challenging, or thanks to your network and connections? Was it something that you managed to do without too much of difficulties?
To be honest, we still did not really partner with any civil society organization. It's a bit challenging. However, we're trying to like collaborate with organizations that do or have like the same vision as ours, but we really can't reach out to them. In other words, I think we're trying to find like to secure fundings for now to be able to broaden our context and impact. But yes, I can say that it's very challenging to find the CSOs and like to connect to them.
Okay, thank you. Thank you. There is a question as well, if you can share maybe the website of your organization and contact or any WhatsApp for the one that would be interesting to reach out to you or connect and collaborate with you, so that that's an opportunity here to share in the chat.
Yes, our website is under construction now. It's not ready, but I can share like our social media links, like the LinkedIn profile and our focal point, the contact person.
Thank you, Hiba. Any other questions for Hiba from the audience? I don't know if there is any hands. Let me check. And maybe another question, were you aware of other diaspora initiatives? Were you in contact with other diaspora organizations in US or elsewhere while you were operating yourself?
Not really. We're not really aware of all of them, but we got the chance to explore them recently.
Okay, we'll be sharing in the chat, and I don't know if my colleague did already, but the one that were mentioned by Rachel, the coordination initiatives by Diaspora, Shabaka, and Engineer, I think it will be shared soon in the chat. Then we have Then we have some questions about the future of Job for Sudan and how it has been securing employment for Sudanese in the countries where you operate.
So the future is basically we want to get registered first to be able to get all the resources that we can't get because of the illegal status. And we are trying to secure jobs for the people, as I mentioned, through the memorandums of associations with the hiring agencies in the Gulf areas, the countries, the UAE, the KSA, and Qatar, where like people are buying or getting work permits, but they can't find the job itself. So we're trying to create this very soon. And we're building like the potential of the individuals by doing the trainings and the webinars, and yeah, so they can be very like competent and up to date when it comes to employment opportunities.
Thank you. Thank you, Hiba. Thank you very much for your presentation. Because of time, we need to move to the next presentation. And so thank you so much. And now I will just quickly introduce, for the one that don't know already, Yassir Youssef El-Amin, who is a medical oncologist and clinician researcher based in Texas. And thank you for being there with us because it's very early for you there. He's the president of the Sudanese American Physician Association, SAPA, a member-based organization operating in Sudan since 2019. In the current crisis in Sudan, SAPA field office is providing direct medical assistance to war victims, IDPs, and refugees. Yassir, please, if you can tell us more about SAPA, as well as what you've been doing since April 2023, and also if you can reflect on the findings and the challenges and the recommendation from the research. Thank you very much.
Thanks very much, Beatrice, and good morning, everyone. Good afternoon, wherever you are. And again, I'm very grateful to DMAC for years of partnerships and helping us network. I'm also grateful to Rachel for the great job she's done and her team in leading this analysis. As Beatrice mentioned, SAPA is a humanitarian organization that is member-based in the United States. We have around 600 members who are mostly Sudanese American healthcare professionals. And we have been registered in the US and Sudan since 2019. And we did have a reasonably sized operation in Sudan before the war erupted. And that put us on advantage in being able to respond to the war quickly. And also due to many reasons that Rachel mentioned, including the fact that Sudan is the country where we were born, where we went to medical school, where we practiced medicine for a while. So we did know the know-how, we did understand the landscape, and we were able to intervene in many areas quickly. Two key things that we tried to do since the eruption of the war. One of them is supporting what is left of the healthcare system. And secondly, try to have our own operation and our own SAP implemented projects. So in terms of the supporting the healthcare system, or what's left of it, I should say, we tried to provide financial assistance to hospitals. Because the government was not able to support many of these hospitals. We have provided support to the operational cost of 15 hospitals across different 5 or 6 states of Sudan. We've also provided direct financial assistance to more than 2,400 healthcare professionals. Some of these healthcare professionals continue to get monthly incentives from us for up to 6 months now. We've also worked with our counterpart inside Sudan to provide initiatives that would help in having feed in doctors' residence, and more than 1,100 Sudanese physicians benefited from this work. We've also tried to support the infrastructures of the hospitals in Sudan, and primarily in areas where we had large presence of IDPs, or we've had areas that are impacted largely by the war. And specific example of that would be the operation room in Madani Teaching Hospital, which is, as many of you know, Madani is probably the second more active city after Khartoum in Sudan, and a lot of trauma cases were coming to Madani Teaching Hospital. And they had one operating room out of 5 that should have been there. So we managed to rehabilitate and provide whether ventilators, whether anesthesia machine to the other rooms to make it a fully operational operating room in Madani. Also, due to the issues of lack of medical oxygen, we've established an oxygen station in Sinja and Sinnar. This line of work, something we do have experience with from the COVID era. Also, the distribution of medical supplies. A lot of large organizations within the US or elsewhere wanted to bring supplies to Sudan, but they didn't know how to transport it inside the country, and so forth. Since the eruption of war, we probably received just a little over $20 million of worth of medical supplies that we were able to bring to Port Sudan from partners like Project Hope, like Muslim Aid, like UHR, UMR, and so forth, and to get some of them to Khartoum and some of them to Madani, and then to be distributed to other states of Sudan. Of course, I'll talk about the challenges in a minute, but to stop here and to say one of the challenges here is that the main port is Port Sudan, which is controlled by the army, which means by definition, you are going to distribute the supplies that you get mostly in areas that are controlled by the army, not by the the areas where are controlled by the RSF, which is a challenge in itself. We're trying to overcome, but with little progress there. And of course, you're faced with the bureaucracy and all the delays. On average, it takes you 2 months from the time that the shipment would hit the ground in Port Sudan to get it moved to its target hospital. So all of these things that we've done to support the existing healthcare. But again, despite that, there were numerous challenges in working through existing healthcare. So we tried to develop our own operation. And now we have 5 offices in different 5 states, in Port Sudan, in Khartoum, in Northern State, in Al Jazeera, and in White Nile, in addition to our office in Chad. Through these offices, we were able to have a robust WASH programs, I think benefiting up to 10,000 people until now. That would include water supplies, would include also sanitation kits, dignity kits for women, and we've implemented this in 3 states so far. In addition, we do have mobile clinics where we go to the IDP camps and provide comprehensive primary care clinics, which include nutrition services, psychomotor support for kids, vaccinations, and so forth. On average, we see around 600 patients in our mobile clinics. One of the challenges that we identified working in these IDP camps is the fact that there isn't a clear mechanism to support patients who need secondary care, so who need specialized care. So we worked with the University of Jazeera in Madani, and also with the government to give us a building that was originally used as a COVID unit back in 2020, and since then it hasn't been operational. So we got that building or hospital, and we rehabilitated it, provided it with necessary equipment, and we're using it now. It has 60 beds, and it's now reasonably equipped. We're using it now as a hospital for secondary care for IDPs, and we've created a mechanism working with other organizations like MSF, Save the Children, and other organizations that provide primary healthcare in Al Jazeera, where they refer the patients who need secondary care to our hospital, which is funded in part by the UNICEF and WHO, in addition to the funding we provide ourselves. This particular experience has been challenging but rewarding in many ways. Obviously, the challenge is you have the very strong grip of the army and over the humanitarian work. So they intervene even in the referral process of patients, which slows this. So let's say I see a patient today in a mobile clinic, to get them seen in our hospital, that can take an average of 4 days, incredibly unnecessarily, but it's due to this tight grip and bureaucracy. So this is in a nutshell what we do in terms of humanitarian work in Sudan. In addition to that, we do a lot of advocacy work and media work here within the United States. I just want to comment also on some of the findings that Rachel spoke to us about, and I wanted maybe to touch on the things that are kind of resonated when I heard and read the work of Rachel. And I'll start about the coordination. I do think that clearly this is a major issue. We do have at the physicians level an experience for years now. So there is the so-called Sudan Doctors Alliance, which include the physicians groups from the US, Canada, Ireland, the UK, Australia, and Qatar. So we sit in this alliance. And after the war, Sudan Doctors Union Committee is added to this group. So we do issue statements together. We do sometimes coordinates, for instance, supporting the residents of physicians in Sudan, supporting the operational cost of some hospitals. We also work together on that. Also in reporting things like human rights abuses and attacks on healthcare professionals. So there's some degree of collaboration there, but it's only limited to one sector. It's not really linked to the bigger efforts in terms of humanitarian relief. Of course, on the other hand, you have the WHO and all of the UN agencies involved on all the whether the healthcare cluster or the WASH cluster and so forth. But again, you don't feel that the sharing of data as robust as one would like to see it, to make sure that there isn't a duplication. I can't tell you how many times we would want to initiate a WASH program in a certain IDP camp, and we find out that another organization either about to start and already secured the funding, or the other way around. So I think we need a more of a national level of coordination. We do attend all these cluster meetings, but these are dominated by international NGOs and by the UN agencies. There is very weak presence of national players who are doing a lot of the groundwork. So certainly coordination is something that we could do better on. And also data sharing, as I said. The second point that I want to touch on is the fundraising. I think SAPA probably is the most Sudanese organization that received individual funding. We've certainly received tens of thousands of individual donations from over 30 countries. So since the war erupted, I think our social media team and our digital marketing team played a really good role in positioning us to be the Sudanese face of the crisis and to be able to gather the trust of the people and to raise the significant amount of funding that we were able to get. Having said that, the amount of funding that we get is certainly way less than the size of the operation and the ways that we would like to expand. So that remains a significant challenge. In terms of getting funding from other bigger donors, obviously, since we have the prior experience and we're a registered organization with a bank account here in America and Sudan, and having the prior experience in getting grants, I think we had a better luck compared to other organizations. Yet we remain disappointed in the amount of grants that we are getting. I do think that the UN agencies and other big donors, we're extremely grateful to them for what they have done. But again, we do think that they are bureaucratic in so many ways. They are slow in so many ways. They are reluctant in working with many of other local partners. And again, there are organizations, without naming them, who are doing beautiful job. We just heard from one of them, and I don't think that the fact that they are not registered should be a barrier towards them getting funding. We try to help other organizations. We know that there is another medical group that we work with. They're doing a good job, and they were offered the grant. It's a small amount, 100K. The barrier was that they didn't have bank account. They weren't registered. So we at SAPA served as the host of this grant, and we signed this three-way agreement where we will be receiving the funds and then dispensing it to the actual implementing partner. But again, I do think while model like this may work, I do think we should come up with innovative methods to overcome the issues around many of these organizations don't have bank accounts, they are not registered, they don't have a monitoring and evaluation mechanism, they don't have an auditing mechanism. So we must have ways to overcome this. I know that the program ran out of time, but I'll just mention quickly two other points. Is obviously the security challenge. This is a grave challenge. Moving supplies is difficult. Ensuring the safety of healthcare of humanitarian workers in general is a major challenge. I think we've seen, for instance, direct attacks on hospitals. At least 20 healthcare professionals were killed since the start of the war. You've had now numerous reports by Sudan Doctors Unions and others around the arrests of and a targeting of activists on the ground. So this remains a significant challenge. I was in Sudan only last month, and I managed to visit Port Sudan, Kasala, Al-Gadarif, Medani. And what I've heard consistently, even from people who work in international organizations, is how difficult for them to move from one area to another due to security reasons or due to barriers imposed on them by the military or the RSF. Finally, I want to talk also about community engagement. I do think that this is an important challenge. While Sudan, what's happening in Sudan is certainly, I don't think it qualifies to a civil war because it's a war mostly between two armies rather than between, elements of our own society. I do think it triggered a lot of tribal challenges. We have seen this in Chad, where you really, really have to be extremely careful in the ethnic background of who we are working with. You have to make sure that you really engage in the community and you're taking a balanced approach when building partnerships. And we've seen this for instance, in our operation in Medani. Initially, we relied on what can be called international staff, although they were Sudanese, but the fact that they came from international organizations and we recruited them, they weren't able to do the necessary expansion. But the minute we started relying on people who've known Al Jazeera, who've been there for years, or spent their time there, they were able to mobilize the community, and now the contribution they're making to our organization is certainly way bigger than the contribution that me or others in the US are making. With that, I would like to thank you again, and looking forward to a fruitful discussion. Over to you, Beatrice.
Thank you, Yassir. Very relevant what you've been sharing, and again, as always, I'm always very impressed by all the work you're doing with SAPA and the way you mobilize as well. This is very impressive, and thank you for reflecting on the different challenges that we can relate to. I don't know, I think we'll have to group the questions because I see the time is running. We will group the questions. I will give the floor, and we'll come back with more questions for you after the presentation of Sama and Asia. Thank you so much. So now I would like to present Osama Mahmoud, that is advocating for and raising awareness for human rights and humanitarian issues in Darfur through his association with the Darfur Union UK. Osama co-founded the Free and Democratic Sudan Media Hub. During his professional life, he has he's dedicated researcher within the pharmaceutical industry. Thank you, Osama, for being with us. And I forgot to also mention you are head of communications for Darfur Union in the UK. I'll let you present as well your organization, what you've been doing, and also reflecting on the challenges. Thank you.
Thank you, Beatrice. Thanks everybody, and thanks DMAC for organizing this meeting, and thanks for giving us the platform as well to talk about this important report, the findings, and also reflect a little bit about our own work within our own organization and the problem that we're dealing with in our beloved Sudan. Darfur Union in the UK, it's a group, it's a civil society group that is mainly working on advocacy for justice, and also advocacy for aid. We are not necessarily a hub to receive humanitarian support and then distribute it to areas in Darfur or areas in Sudan, but mainly our work is on the advocacy aspects, to working with governments as well as working with international organizations, not necessarily here in the UK. Mostly our work is with organizations outside the UK, but from our position here is to reach our people and also to promote their just case. We believe that the root of all issues that we are facing at the moment is the lack of accountability and justice, and that's what results in war, and that results in the issues, of the humanitarian issues that we are dealing with at the moment. I have a few slides that I would like to present and to reflect also the findings from the DMAC report, which is a quite important report. But I was struggling in terms of what's the first slide to show, and I think I shall start from the middle rather than the end. The reason being, I think I've heard quite a few people here talking about the difficulties of security and access to areas of war. The problem of Sudan in Darfur, as we always define it, is not necessarily started on the 15th of April. It's started long before then, and it's a long history. I don't think the platform will allow for us to talk about when it started and what's the reason for it. But the region has been engulfed in war for so many times. War has been waged in this area for a very long time, and every once in a while we've seen evidence that we have not reached a complete resolution of the issues of Sudan in this particular warring area. And at the moment, and since this platform is kind of concentrated mainly on the 15th of April onwards, since that particular date, we have faced the huge challenges, huge security issues, and of course, the aid is kind of is only a reflection, the issues of aid or of the security issues that we have on the ground. Before you hear, this particular slide highlights the reports that issued by the Darfur Union in the United Kingdom. And we issued more than 30 or 40 reports since the war have started. And the reports are mainly talking about the humanitarian aspects, the security aspects, the demands of the people on the ground, and also what we see as not necessarily just solutions, but some steps that can be put in place to make life of the people who remain there, or people who have gone to the IDPs, new IDPs, or people who have fled the country completely to go to Eastern Chad. I know people talk a lot about Adre and Adre refugee camps, but even within the east of Chad, you know, there are more than 5-6 big camps, and also smaller camps within nearby cities such as Abeshe. It's not near the border, but other areas such as Hiriba and so on. So the calamity of the issue in Darfur is that we have a genocide or a war crimes that's recognized, previously recognized by the international community, but at the moment there are new investigation of new war crimes. So that makes life so difficult for the people who are delivering aid or delivering or trying to secure the making secure passages of aid to go to different areas. I'm talking about bigger cities such as El Geneina, Zalinje, even Al Fashir, Niala. I mean, those are, talking about Niala being the second largest populous city in Sudan and one of the most important hubs. This is a city, at the moment, it's literally been evacuated. All these people are living in the outer skirt of the area. So when we're talking about delivering of humanitarian aid and the challenges that we are facing, there are huge challenges. And I'm going to reflect on this by going to just talking about one or two slides here. So one of the main missions that we've done in the Darfur Union. So as I said, we are advocacy group for justice and humanitarian aid. The issues that since the 15th, we had to really transform to actually trying to be involved in the aid delivery and also collaborating with Sudanese group and also international organization across the world. So back in June, there was we have an extensive network on the ground. That's due to people who have in the union itself that they have relative on the ground, or just because we are an organization that's been there for the last 20 years. So we know people in the grounds, we know people, and a small organization as well on the grounds that are working to deliver aid and also to make life a difficult life easy for the people if that can be used here. So I am part of an organization called Sudanese Pharma Nomads. So this is a Sudanese group of Sudanese in the pharmaceutical industry scattered around the world from the Far East. We have people in Japan to the people who are working in the pharmaceutical industry in the US and across the world. So this group has been quite active since 2017. And we help each other we help people finding jobs at the same time. Also, we did help people deliver aid and medical aid, especially to certain areas in Sudan, including Darfur before. Since the 15th of April, this has been so difficult. So the Sudanese pharma nomads have reached out to the Darfur Union and asked if you guys need do you have a specific areas or a proposal where we'll be able to deliver the aid that we've collated especially in the Gulf, in the Sultanate of Oman. So we have a hub there. We've managed to collect, and through this group, we managed to collect some medical supplies and also dry food. The dry food we didn't manage to deliver, but the medical supplies in particular, there was a good amount that we needed to deliver to the areas. Through our connection in the Darfur Union, we've identified 2 areas, and that area is in the outer skirt of the small city/town of Kornoy in northern Darfur. And I just wanted to kind of put a little bit of perspective in terms of where that is. So that is Kornoy there on the right-hand side there highlighted. And we had, with our connection, and again, our connection helped us in 2 things in terms of identifying routes, but also getting favors from individuals to be able to deliver the goods from A to B with no cost. So through our connections in Chad, we managed to deliver these goods from the Sultanate of Oman to Chad, to N'Djamena, and from N'Djamena as well, we've managed to deliver this for free to the town of Hiriba, or Hiriba in Arabic. And then in Hiriba, then again, we had to rely on our personal connections to be able to deliver this to the town of Tina. It's become an instrumental kind of cross point from Sudan to Chad. And there is a Tina, which is Tina in Chad, and there is another town called Tina in Sudan. So they are separated by a valley. So we managed to deliver it to the Tina in Chad, and then from there, actually the journey from Hiriba to Tina, this was done by a UN agency, which is really great. This is the first time that we've managed to access, again, to be able to talk to UN and to be able to do some collaborative work with them. And this is just by saying, hey, listen, we have people there. If you are able to deliver this, we will be able to deliver it from Tina to Kornoy. the UN agencies that we've tried to reach out to for so many long time. I think when we made the initial connection and be able to talk to them, they said, I think one of the things that they mentioned, because we work in the area of advocacy, they said, you guys make a lot of noise. And again, this is something that I would like to highlight later on when it comes to the challenges and also way forward. So yeah, long story short, we managed to deliver the goods to Kornoy. From Tina to Kornoy, this was a really difficult journey. And again, here is where you rely on volunteers or people who are driving or having the means to take the medical aid from A to B, whilst they are putting themselves in risk. So when someone is taking this initiative and helping you to deliver the aid from A to B, are you putting their life in danger? And then you really don't have anything to give them other than perhaps the fuel to go from A to B because of lack of resources, and that we have. This is not particularly in our area, but we are facilitators. So yeah, it's this particular project that we've managed to execute. We've done it twice, but with a lot of challenges. One of the main challenges, as I said, the security and being able to use the same route. Every time we've used it, we've used a different route because the people on the ground will tell us that route is no longer viable or no longer accessible. So this is one of the projects that we've dealt with. And I say, again, we have to change our trajectory from being advocacy group to working and trying to delivering aid and facilitating this for other organizations to do it because the extensive network we have on the ground. The second example that I have is also delivering some aid and dry food to Kutum. And again, just I will show the map, maybe it will speak better than the word in itself, but it's been a journey. We had to rely on, again, collective of efforts and goods to Jeddah, from Jeddah to Port Sudan, from Port Sudan going to Wad Madani, which I heard that's early on in my colleague presentation, being an important hub. And then from Wad Madani across to Darfur, this is also a route that it's very dangerous because you have a lot of people who have, the fighting groups, particularly RSF, are controlling most of that route. So what we have to rely on here, and again, through some connections that we have within the union, we have to rely to people to talk to the joint force. So the joint force is made of signatory of Juba Peace Agreement. And this has been cited by Volker Petrus, the former head of UTANAMIS in Sudan, as being one of the most successful stories amid the darkness of the war. As in, they've been delivering aid. I think recently they've managed to deliver 1,000 truck or 1,000 car full of goods from Wad Madani to the different regions of Darfur. So it's become a lifeline for Kordofan and Darfur to have these convoys, security convoys, to take the goods from A to B. So again, through connections, through facilitations, talks, we managed to deliver this goods from A to B, dry food and medical supplies. But again, I wanted to conclude or highlight mostly is those are individual efforts by our different organizations, which are really great. People are really dedicating time. They're burned out completely because you have to support families, extended families. Our definition of families of Sudan is not necessarily your mom, dad, and sisters and brothers. Is the wider community, is the wider family, is the neighbors. So people really have to dig in deep to see how strong they are in terms of facing this particular challenge. There is no way for you to rest. That this is the situation that everybody who spoke in today and people I'm sure in the chat, they are facing at the moment. So having said that, you still have to go on and life goes on. So one of the main challenges, all this great work that we're doing is a drop on an ocean, in an ocean. We're talking about almost 1 million people have been crossing the border in Darfur to Chad. We're talking about Sudan is #1 at the moment in terms of internal displaced people. We've talking about refugees that's gone to Egypt, to Uganda, to South Sudan. South Sudan have received a lot of people at the moment. And the UK definitely is trying to help or through our communication with the UK, they're trying to help people in South Sudan and in Chad. They've cited that, although the money that they get, it's not enough. So I just wanted to highlight the challenges in terms of the complexity and the volatile security issues, securing the resource and funding. I think it's a nightmare. No, I think at the moment the world has 3 other priorities. I think Darfur is not, or Sudan in general, is not even featuring in any of these priorities at the moment. I think my colleague talked about the bureaucracy in terms of getting aid from A to B. You know, we dedicate, for example, we hear one particular area saying, oh, we want this particular, let's say, aid to be delivered to point A. You go, you gather, you do all your effort. It takes you 3 months, 4 months to be able to deliver it. And then within this 3 months, they will have another need that's more important than the first need. So this is one of these challenges that we are facing a lot. The lack of media coverage is one of the issues that we are dealing with. I've highlighted here one of the tweets yesterday about the killing of almost 45 aid workers. That's highlighted by UN OSHA of Sudan. So that's one of the difficulties that we're dealing with. Possible way forward, collaboration, we've talked about it, maximizing collaborative effort either internally, externally. I think that was mentioned in the DMAC. Rachel part talked about it very, very well there. Engaging in advocacy and awareness. I think this is something that we're lacking and requires the least of effort. I think at the moment, we're not making enough noise, or the language that we are making is very soft. I think very, very, very soft. We need to be a little bit more potent with regards to our message. I think this soft approach may work, may work to and have been worked to get us to a certain level. But we're living among sharks and so many other priorities in terms of headlines around the world. I think we need to be a little bit more aggressive to reach the other areas. And I conclude by just going through very quickly some of the messages and what I just wanted to highlight one thing. So I think this was something that we've reached out to. I don't want to name certain individuals or certain organizations, but we've reached out to a couple of organizations in the past, or 3 of them, and we got the generic response in terms of, this is how we do, this is how we allocate our money, blah, blah, blah. What we had to do then, we had to go public and say, hey guys, our audience, we've reached to these people and this is what we received, or this is the type of response that we got. And we've talked to them about it as well. We hope to hear something differently. Lo and behold, you start having a little bit better communication after that. And this is where I'm saying is that there is a balance between actually being advocating and talking about your own cause, but at the same time, I think you just need to be a little bit more creative and also a little bit more aggressive with regards to your message moving forward. We've talked about other campaigns regarding the leveraging of elections and promoting Sudan Just Cause. This is for the diaspora around the world, and also talking to different government officials and moving forward. I conclude by this in 1 minute is that one of the most important things that we are facing, especially as I said, is with regards to the advocacy aspect, is we are dealing with a lot of misinformation out there to our just cause, to our humanitarian issues, to our whatever you call it, we are dealing with. And that's why it's quite important to set the narrative, the language, the terminology, and calling things as they are as we move forward. We're dealing with we've seen in some reports, there is a lot of fake accounts, there is a lot of bots that's creating tweets and so on with regards to the Sudan situation. And that's quite distracting to the people, and the people who are outside who want to donate to Sudan or wanted to see this particular area have some issues and so on. So I think talking about the importance of the narrative language and terminology, I think is quite important for us to set that correct and also move forward. I thank you very much for this opportunity and platform, and I get this back to you.
Thank you, Osama. Thank you for impressive again what you've been doing in terms of advocacy and making noise, as you say. We are running a bit late, so I will quickly move to the last speaker of today. Let me introduce you Asia Campbell, who is a project manager at Internews. She works in the field of community engagement and accountability to support humanitarians in addressing rumors, community feedback, and information needs of people affected by the conflict in Sudan. She has been project manager for Internews COVID-19 Rooted in Trust project and working in different humanitarian and public health response. Yes, so I will let you speak, Asia, and reflect based on what you've been seeing with Internews around the role of diaspora, and as well as also reflecting from your own being yourself a diaspora yourself that was unfortunately displaced as well. Please, Asia, if you can speak and keep it brief as much as possible. Sorry for that.
Sure, I will. I think I'll do it in 2 minutes so we have time for discussion. Thank you so much for the opportunity. I want to express my appreciation to Rachel and you and the rest of the team, but also to the fellow panelists, Hiba, Yasir, and Usama. Incredible work, very inspirational, and it is appreciated more than you can imagine. I just want to highlight the work that we've been doing at Internews. We're currently running a social media listening project about the Sudan conflict. It's a service we're offering to the humanitarian community. And we have been in touch with some diaspora actors and organizations. We recognize the powerful and important role the diaspora has in Sudan, and that precedes the conflict of April 15th and any other conflict. But I think Usama summed it up beautifully. Our definition of family is vast, and it includes extended family and members of our community, our neighbors, and possibly people we don't know. So that sense of solidarity and kinship is very much, I think, a part of the Sudanese identity and plays in these different initiatives that the fellow panelists have spoken about. Our social media listening project is a qualitative method, basically listening to affected communities, people impacted by the conflict and displacement in a manner to understand the needs, to understand what the information needs and gaps are. And this can come in the form of rumor tracking. Rumors reveal people's hopes and also their fears, but also they speak about serious information gaps, especially during times of armed conflict. I just want to highlight the diaspora's role. I think Rachel really touched on that beautifully. I just want to make some additions to what we're seeing, how the diaspora is sharing community appeals and requests for support and guidance from people on the ground affected by the conflict. And this can be on a range of different issues. The call for dignified burials, healthcare support, people looking for medicine, looking for healthcare or emergency care, people looking for a bus or someone to evacuate their loved one or family, people wanting more information about safe routes. I think we can see from our social media listening exercise since the beginning of the project, since 17th of April, we can see the diaspora really amplifying the voice of the affected people and sharing their questions and needs, and diaspora influencers stepping in to do that part. But some of it has been highlighted by you, the advocacy role that the diaspora plays, and the major role that healthcare providers, healthcare actors like Sudanese doctors, which you touched on, Yasir. This is something that has also been really noticeable in our social media listening. Also, the role that the diaspora engages in tackling conflict-related disinformation, and this is something that is also quite prevalent and obvious on social media. In addition to advocating for humanitarian access and international pressure to limit the effects of conflict on civilian populations, but also for fundraising to respond to humanitarian needs and research, such as this one and other researches about humanitarian support and the diaspora's role. So these are some of the issues that I wanted to highlight very quickly, and just to touch on that. But back to you, Beatrice, because I know we are pressed for time. Back to you. Thank you very much for the opportunity to speak.
Thank you, Asia, and thank you as well for your support, since you were also part of the consortium that you also supported us with the translation into Arabic of the report and the executive summary that will also be available soon. It just needs to be reviewed last time before being shared. As well as reflecting, yes, on the important role of the diaspora in Sudan during the response. We had speakers today and great example of diaspora initiatives. It's only a few of those, but very important ones that are filling gaps in terms of livelihood opportunities and great networks, as mentioned by Sapa and Asia, of the health Sudanese community that step in and has been very active in the response. In terms of advocacy as well, very strong voice for the people that are the most affected and the one that need the most to be heard and to pay attention. We don't have much of time, but I would like to highlight that there have been some comments about the wish of connection and establishing network and especially solidarity between registered organization and the one that are not registered. How can such collaboration can be made so that to enable those organizations to access funding and financial support. So we will be sharing the contact of all the speakers from today's, as well as the mapping that has been done by DEMAC is available on the website. When you click on the diaspora mapping and per country with a geography, you can find all the organizations that have been mapped. Thanks to Rachel and her team, Conciliant, for great work in identifying all those actors, diaspora actors, as well as doing this very qualitative research where we learn a lot about the role of diaspora during this response. We really encourage you to look through and read the report. I think it's been shared by my colleagues in the chat, the link to access the report and executive summary. They are now available in English, but will be soon as well available in Arabic. And if for the one that have been attending today, this session, if you can scan this code and then fill in the form, that would be also very helpful for DEMAC to learn and how to improve for future events as well as for future research and future work with around Sudan. I'm really sorry that we don't have much of time to actually address, because we had great presentation from all the speakers today, and we don't have much of time for addressing questions, but we will make sure to follow up and make the connections between people that attended today and want to be connected with the organization that were present today, or any other organization that have been mapped during that exercise. Yes, I think we are really coming to the end. So I really want to thank again all the speakers of today's. for attending and doing such great presentation and highlighting the work you're doing, as well as Rachel. And I hope it gave you a better sense of the Sudanese diaspora response to the ongoing humanitarian crisis. Don't hesitate to follow us. You can see here, and either contact us as well if you want to have additional information or contact, or to be connected with diaspora organizations. Thank you again for everyone being there with us today, and please share the report and the executive summary and spread the word about the great work done by the diaspora and how they should be recognized for the work they're doing. Thank you very much.
Thank you.
Thank you so much. I just gave you a standing ovation. Incredible work. Thank you so much for giving us strength during such a difficult time, and for keeping the struggle, keeping the humanitarian needs in Sudan on the agenda. Thank you so much. We appreciate it, and we felt the support. When I was in Khartoum, we felt the energy coming from the diaspora and the care and the support. So I just wanted to say that. Thank you.
Thank you, Asia, for highlighting that. Thank you so much. Thank you. So now we will be closing this session, and then we'll be there for you if you want to have more information. Thank you very much, and see you.
Thank you.